Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
All right. Well, we are at NCPDP Annual Conference 2026, and I'm excited to have Brigid Groves from APhA join us for the Unscripted podcast. So welcome.
Thanks so much, Pooja. Glad to be here.
Yeah, fantastic. So I'd like for you to start sharing your story. How'd you end up at APhA, and what do you do there?
Sure. So as you mentioned, I am at the American Pharmacists Association. I'm our Vice President of Professional Affairs. And I have had a little bit of a fun background on my way to being at APhA. I actually started in a grocery store-based chain pharmacy and was a pharmacist, had a district coordinator role, and was one providing a lot of the clinical services that I'm advocating for and describing now in my current role. I also worked in peds primary care and population health, and so worked alongside our physician and nurse practitioner colleagues like in the clinic, and so had a really great experience seeing some of the challenges that I'll talk about here in a little bit from a firsthand experience. Within my current role, I oversee pretty much anything that comes our way for anything pharmacist, pharmacy technician, pharmacy team member are doing out in practice. In particular, helping to assure coverage of and payment for pharmacist services, helping to work through challenges with pharmacists accessing data, and really prioritizing the opportunity to advance the pharmacist role and scope across the country.
Yeah, that's great. And we're really seeing a big shift in that. So it's interesting to hear that your background, for it seems like we always say like, oh, it's just starting, but it's been going on for a long time, right? That pharmacists doing clinical services.
Oh, for sure. I mean, the clinical service provision from pharmacists has probably spanned the entire time that there have been pharmacists. And I know we recognize that as those that are in the profession. I think what we don't always see is those outside of the profession recognizing that value or what that pharmacist is doing is a clinical service and is using that cognitive skill and the training and expertise that they possess.
Yeah, that makes sense. So APhA recently released a white paper talking about this. Can you talk a little bit about the white paper and the content of that?
Sure. Yeah, so it was about late 2025, recognizing that pharmacists' role continues to grow and evolve in the provision of clinical services. One of the challenges we identified and is laid out in this white paper is the lack of information sharing and clinical data exchange sharing. So that lack of interoperability, which is really the main focus of the paper itself. So it starts off by describing the challenges and the issues that we're seeing, which I know many of us are experiencing firsthand and could certainly describe. But what's really interesting and unique about the white paper is that it then goes into recommendations for implementation to overcome some of these challenges. So through a phased approach in a stepwise manner, helping to link in with some of the standards and helping to make sure that those are consistently applied across different settings. Helping to describe the use cases and who you might need to connect with at different organizations. It takes into account that while we're not in a perfect system right now, that's okay. That shouldn't prohibit us from taking action. And these are some of the things that you can do, whether you're a current pharmacist, whether you're in leadership and administration, or whether you're more outside of the scope and trying to help implement some of these changes.
That's great. And I feel like it was a couple of years ago, you guys pulled together a kind of a stakeholder group that talked about it, right? And so it seems like there's in some states, kind of pockets of work happening where pharmacists are getting credentialed and they're actually getting paid from health plans, but it's just not nationwide yet. So
yes, and on that note, from a pharmacist and health plan partnership, APhA has had what we call our learning collaborative that really partners those pharmacists and health plans together to learn from one another, to share commonalities, but to talk through barriers as well. As such, probably about 2 years ago, and in follow-up to one of the summits that you mentioned, APhA did publish a set of recommendations on how health plans and pharmacists can partner together to assure that coverage of pharmacist services. But it also goes into a lot more detail of recommendations around the credentialing process, around the enrollment process. We recognize that those are key components to being considered that provider under the lens of the health plan. But oftentimes pharmacists are maybe less familiar with what some of those components exist and how they could do that.
Yeah.
So that set of recommendations is meant to more so be that 30,000 foot level primer, if you will, and then working with organizations and other collaborations, helping to get that information into the hands of pharmacists on what is it they need to actually do at the point of care or at their employment place to get an NPI, to get credentialed, to enroll as a provider under those health plans.
Yeah, that's great. And because I know, a lot of times when I talk to folks that are trying to do this, they'll say, oh, I have one program set up or but they're not actually going through that credentialing process.
Yeah.
And I think it's so important for people to say and to recognize that we don't want a separate process for pharmacists, right? They should be going through the same process of any other provider. So, yeah,
Yes.
I know you guys support that a lot as well. So.
100%. I went to one of the sessions earlier today at the meeting. They've all been really insightful and just invigorating. But one of the comments that stood out to me was that instead of creating another pharmacy-specific pathway or pharmacy-specific this or that, fitting into the existing healthcare system is a way that we're going to, first of all, rapidly get a lot more growth because it's already in existence. The standards are already there. The mechanisms for billing and coverage. So instead of us trying to recreate the wheel, we need to fit into that wheel. But then the other piece is making sure that those on the health plan side also are seeing that.
Yeah.
And so it does take some education and conversation with some leadership internally at some of the health plans. And after having those conversations, they're like, oh, yeah, it does make sense. Why would we do a whole new process
Right,
for a
right,
different
yeah.
provider type? Like have them check mark the box for pharmacists instead of other healthcare clinician and move on.
Yeah, that's great. Well, let's take it back to the interoperability.
Sure.
And I know you're involved with some of the Sequoia Project Pharmacy Interoperability Work Group work. So just curious, kind of what insights have you gained from that? I thank you for your participation. I know you've really helped kind of pull the use cases together, but would just love to get some insights from you on that work as well.
Excellent. The pharmacy work group within the Sequoia Project has really been a very exciting part of the work that I've been able to do the past couple of years. It's been very collaborative and collegial, which has been a really nice opportunity to learn from one another, to hear. We have that common goal of getting pharmacists and pharmacy data interoperable with other healthcare systems. So I think, looking at that, it's been just a nice opportunity itself. The use cases, what I found most valuable is that we don't have a problem from a clinical standpoint. The services are happening. We know many states have already authorized pharmacists to do these types of things. Pharmacists are qualified and skilled. They know how to do the service. The challenges are the structural pieces.
Yeah.
And I think that it's been really valuable to react and to talk through that with others that are more experienced or maybe deeper into the space of how we do have some of these conversations. You had asked, what was maybe an aha moment or something I learned through this work group. And in particular, it was developing a lot deeper knowledge around TEFCA and the QHINs, and where pharmacy has an opportunity to elect to join those.
Yeah.
And I would highly encourage us to do that because I
Yeah.
think that will allow us a lot more rapid integration in the interoperable data exchange space, and would do so in the manner that's already being, from the administration level's standpoint, follow these processes. The TEFCA model is there. It's the highway, jump on. How
Right.
and pharmacy should be part of that.
Yeah, absolutely. And, I think we shared maybe in the session earlier as well that, so we did create those use cases. We turned them into the RCE side, so the recognized coordinating entity, and they are interested in talking to the work group about how do we get pharmacists on faster. So it's great to see that. And, it's nice to, I think, see all the associations, right? You all, NCPA, NACDS, NCPDP, we're all kind of working together on that clinical services. So tell me a little bit more about other things that APHA is working on and maybe things that you're working on.
Yeah, one of the things that we've most recently delved into is how our pharmacists, we talked a lot about clinical services and they're trained to do them and they want to do them, but maybe, or how do I start? Where do I need to begin from an implementation standpoint? So we have recently developed a practice implementation center, which has a variety of toolkits that help from start to finish on how you would implement a whole clinical service. And those toolkits are really valuable kind of step by step. As pharmacists, we love to have a checklist, and they're really friendly from that manner as far as getting things going. But where we're challenged then, and so something else that we're trying very diligently to work on is that data exchange piece and continued integration into team-based care models.
Yeah.
We know that there are workforce shortages of a variety of healthcare clinician types across the U.S. Pharmacists are frequently visited by their patients and are most commonly located in those areas where they maybe are less primary care and other healthcare provider types, but aren't always as fully integrated into that team model. And so we're working a lot with other healthcare entities to try to help, showcase the value and help them to integrate them into that team. And thinking that team doesn't have to be that team within a clinic,
Right.
but that team, because that patient's out in the community too. And so
yeah.
where our pharmacists are out in the community.
Yeah.
And so that's another focus area for the association as well.
That's great. And I think we heard in the keynote this morning from Alex Azar, right? I mean, their whole focus on, value-based care and including the pharmacists and, how do we come up with models, right, for that reimbursement? And it could be that, it's this team-based approach, but you don't have to be part of that clinic or, and do that kind of stuff. Great. Well, as we wrap up, I'd love to just kind of get your thoughts on, what you're hopeful for. I mean, I feel like we're starting to see progress and, we all have kind of been in this for a long time, but just curious what you're hopeful for kind of looking forward.
Yes, I have had this thought in my head for many years, but as pharmacy's always at a cross point, is always at a tipping point. We're always at the next item, which makes our profession so wonderful to be in because there's always a next opportunity. I think what we're really looking forward to is how AI and other technology supports, and I use that word intentionally, supports the pharmacist and their clinical knowledge, because the professional judgment and that role and that engagement with the patient is so essential. But having some of the administrative burdens and other systemic challenges removed through AI and other technology supports, I think is something we're going to see come more and more rapidly. And I personally am really looking forward to helping that come along.
Yeah, that's great. And I think that also just gives the pharmacists more time to do some of these clinical services. So that's fantastic. Well, Brigid, thank you so much for taking time out of your schedule to join me. Really appreciate it.
Thanks so much, Pooja. Appreciate the opportunity.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.